Hello, I'm grateful that you have joined me. I'm Rebecca Rose. I'm a credentialed veterinary technician in Colorado and the founder and president of Catalyst Veterinary Practice Consultants. Career choices within veterinary hospitals is quite a great topic to discover and to unfold because there's so many options and it will affect and impact so many people individually, collectively, in a team, and the patients we serve, and all of these things. So with that, we will get started. And again, thank you for joining me. The first question I would like for you to consider is without boundaries, without consideration of how much is it going to cost me? Do I have enough time? Will I be supported? How am I ever going to accomplish this? Without that, take all that aside. What do you want to be doing or being in your career? Oftentimes we don't allow ourselves that big vision, the opportunity to really create and think big. But that's what I want you to do today when we're going through these ideas. So the general topics for today will be related to surveys around veterinary technicians, resources, and wages. Now, the majority of what we're going to be talking about is within the United States. However, if someone wants to know more or wants to reach out to me and find out what's going on within their community or country, give me a shout out. And I'll be giving you information at the end of this program to contact me. You will be receiving a career roadmap, which is a great tool for you individually, but also for your practice manager or veterinary owner to have. And within veterinary practices, there's opportunities to be a supervisor, move into practice management, upper management, offer relief veterinary technician services, become a veterinary technician specialist. There's many opportunities for self-employment within veterinary hospitals and creating unique niches, plus this idea of practice ownership. Truly, your career is in your hands. Now, I have yet to walk into a veterinary hospital and find a manager speaking with a new team member that says, I am so happy you are here. For the next 2 years, my sole driver and motivation is going to be keeping you afloat and supporting you in your career growth. I'm here for you in all ways, shapes, or forms. Now, rarely does that happen. Veterinary practice managers rarely have enough time for their own career development. However, with support and bringing forth some of these ideas and a plan, there's really no reason why you can't create some of these job opportunities and career opportunities within your veterinary hospital. So truly, the sky is the limit. One time I was speaking with a young veterinary technician many years ago, and he piped up in the middle of a class and said that he wanted to start an ambulance service. And lo and behold, in California, there are ambulance services, and actually that service is being provided all over. Regardless of your idea or what you think you might want to become, look at it without judgment. Because the fact of the matter is you can probably create it through leaps of faith, being persistent, and finding that support. This is a scary statistic. And it says that turnover is twice that of other industries at 29%. Now, in other industries, turnover is typically 15%. That's what we should be striving for within our veterinary hospitals even. And that's when someone leaves because maybe there's an ill parent or they need to tend to somebody. Possibly a spouse got a new job, so the whole family's moving. And there's a plethora of reasons, but in other industries, turnover is 15%. Now, I've actually worked with veterinary practices that are upwards of 50% or more turnover on an annual basis, and that is a travesty. There are solutions. Now, when I'm looking at the reason for turnover, I come up with a few theories. One, and the one that veterinary technicians will hang their hat on most often, is that there's low pay. Well, I can see and understand that. However, in a well-managed practice where veterinary team members are properly leveraged and supported, there can be appropriate and adequate compensation for that, along with just having the autonomy to do what we need to do, support within our veterinary hospital to grow our career, advancements, and all of these play in an important part of longevity. Now, what I find to be true and what I think is happening is that most veterinary hospitals are undermanaged or underled. Now, what does that look like? I'm not saying that there needs to be a lot of chiefs for very few Indians. No, I'm just saying that middle and upper management has a vision and a purpose and a master plan, that there is support for veterinary team members, that there are goal setting and the opportunity to reach towards goals in client satisfaction, patient care, and all of that. Now, underled could come from the owners without a vision or knowing where to take everybody or where that hospital wants to be in a few years. So oftentimes what happens are team members are in their veterinary hospital kind of on that hamster wheel, going around and around and around every day, same stuff every day without a common goal. So that's how I see being undermanaged and underled. Now, I do know that burnout is high within the veterinary community, and compassion fatigue, I think, is misunderstood and misdiagnosed, and that we lose a lot of wonderful, wonderful team members, veterinarians, technicians, assistants, receptionists, and managers due to compassion fatigue and the trauma that they experience from the job that they do. So I'm just going to throw that out there. It's not the topic for today's discussion, but I think it is important to know what I have determined in this idea of turnover. So in the spring of 2016, the National Association of Veterinary Technicians in America did their survey, their demographic survey. And from those respondents, they asked 5 most significant problems that you face as a veterinary technician. So I'm just going to go down the line here. I'm actually going to go number 6. So low income, we just talked about that. Burnout, yes, it is in our practices and experienced by our team members. Lack of professional recognition. Lack of career advancement opportunities, and that's what we're going to elaborate on today. Underutilized skills, which I know is true. Leveraging and properly delegating to team members is a very satisfying, rewarding aspect, and oftentimes we're not leveraged to our max. Then there's this idea that there's competition with over the job trained assistants and technicians in veterinary hospitals, and also compassion fatigue. And there's a plethora of others listed here. You can see those. But today our focus is going to be on career advancement and how can we grow our careers in veterinary hospitals. Now, there are a number of resources regarding salaries, because I do think a lot of technicians want to know this piece. This is a great resource, salaryexpert.com, and you can go on there and plug in the title of veterinary technician, answer a few questions, and receive a free report that will show you in a zip code specifically the low, medium, and high range of salaries for veterinary technicians, plus the cost of living. So oftentimes I hear, yeah, there's veterinary technicians in California and in New York that are making a great hourly wage, but the cost of living is also very high. Whereas maybe a veterinary technician in Arkansas or Missouri might be making a good wage and the cost of living is much lower. So see how that needs to be considered when you're looking at pay. Here is a graph from the 2016 demographic survey showing that approximately 78% of veterinary technicians do work in veterinary hospitals. So that percentage comes from the food animal, equine practice, mixed animal practice, emergency, specialty, and companion animal practice. So that's what we're going to focus on today, people working in those. But it is important to see, too, that veterinary technicians are working in education and also animal shelters, industry, and self-employed, and a small percentage also in the government. Now, these numbers come from the NAFTA survey in 2007, where they actually showed 4 different hospitals what were the salaries for those technicians. So an easy way to figure this out as an hourly wage is divide the salary, the annual salary, by 2,000. As an example, a specialty practice, let's round that up to 40,000 a year, would be approximately $20 an hour. But these are good numbers to know. Another great site for more statistics is the Bureau of Labor Statistics, www.bls.gov. And it showed that in 2016, there were 95,600 veterinary technicians declaring on their taxes that that's the job that they did. And the average was $15.29 an hour, which equates to roughly $32,000 a year. Now, on the Bureau of Labor Statistics are also wonderful graphs and other pictures like this one. And I feel these are valuable because you can see from this one, where are the supply and demand and the most veterinary technicians. One time, an industry partner asked me, where would I put a new office, a satellite office, in where they wanted to employ a number of credentialed veterinary technicians with about 7 years of experience. And I gave them my gut feeling, and then I went back and I looked at these kinds of statistics and identified the best place for them to place that office. This could be utilized in so many ways. Maybe you want to move somewhere, or your spouse needs to go somewhere. So how would you determine what is the supply and demand in that state? Go to this website. Now, in October of 2016, there was a great article in the Journal of the American Veterinary Medical Association about the veterinary technician shortage. And it stated that it's probably not a shortage of technicians. We're graduating a number of them. But what's happening is there's such an attrition rate and they are leaving the veterinary community that makes it tough. So if you have an extra moment, and that might be a great article for you to read. Here is the Cheshire Cat, and you may recall him from Alice in Wonderland, but the Cheshire Cat simply says, and stated in the movie, if you don't know where you want to go, it doesn't make any difference how you get there. If you don't have a plan, it doesn't matter what you do. If you don't have an objective, who cares if you ever reach it? And if you don't take responsibility for your actions, who will? So it comes back to that big, overlooming question as to, without boundaries, what do you want to be doing in your career? And what are you willing to do to make it happen? Well, I strongly suggest that you, as a veterinary technician or assistant, or whatever your role is within the veterinary hospital, really hone your skills and become good at a number of procedures and very well-rounded. So hone your skills in a species that you like working with, but also in all the species. Do more research and understanding of anatomy. Definitely increase your skills in anesthesia and pain management, animal husbandry, preventive medicine. I strongly encourage you to increase your communication skills amongst you and your coworkers, plus the clients and even industry partners or representatives that come into your veterinary hospital. And really focus on growing and becoming a really great veterinary technician with very defined and advanced technical skills for at least 2 to 5 years. Because once you do that, then truly the sky is the limit. Now, obviously, within veterinary hospitals, there are choices. Veterinary technicians can choose from a high-tech, high-volume, high-touch corporate facility or a smaller mom-and-pop hospital. Now, both can offer quality medicine, and it's up to you to choose what fits your style and what veterinary family you want to work with. But there are fantastic choices and opportunities out there. One time I spoke with Dr. Michael Andrews. He's a past president of the American Animal Hospital Association and a former veterinary technician. So I simply asked, what advice would you give veterinary technicians? And this is what he said. It is critical that technicians learn to leverage themselves. I believe that soft skills such as supervision, education, training, and leadership will be essential to their success. And I have to agree wholeheartedly with that, because it's through supervising and managing veterinary practices, education and training, and leadership within my own career that I have seen great success. You will find in your handouts accompanying this recording a download for the Catalyst Career Roadmap. But you can also find it on my Catalyst Veterinary Practice Consultants Facebook page as well. And I encourage you to like us there. I feel it's a pretty good place for engagement and networking. The career roadmap is designed for you to look at your future and systematically go through this process and really make it happen. So once you decide what it is you want to do, we're going to elaborate on the flow, but fill it out. It is amazing that there's this synergy and energy that occurs when you write down a thought and define it and place a deadline on it and give it real meat in writing. And so that's what this tool is for. And also to celebrate once you've achieved your goal. We do not celebrate near enough personal or professional achievements. So when you're doing this, and again, considering without boundaries, have a plan. Think big, think grandiose, and find a mentor that will help and support you in this. There are a number of them, and what I've learned and experienced in my career is mentors believe in you more than you believe in you, and they do really want to help you succeed. And also this idea of SMART goals, which we will elaborate on. So on that career roadmap, go through and identify specifically what is the title of the position you want to hold or achievement. Make it measurable. When is it going to be due? And attainable. This is how you're going to do it. And these are the skill sets and these are the classes. This is what it's going to cost. And realistic, that yes, I can do this. I already have this skill set, this understanding, these award-winning attributes that are going to advance me down this path. Make it timely, make it time sensitive by saying, I will accomplish this in 3 months or 6 months or a year, whatever it takes. Now, to become a veterinary technician specialist, realistically is 3 years. And if you don't find this goal and achieving it thrilling, find something else. Make this worthwhile for you. Certainly within veterinary hospitals, there are a number of you that have the skills and the knowledge and the aptitude to be an advocate and lead your teams, whether that be as a department lead, receptionist lead, senior veterinary technician, or team trainer. From my experience, veterinary hospitals around the world would benefit from having a team trainer. Oftentimes a team trainer is more of a senior technician, has great communication skills, really has a desire to help and support team members to even be better than he or she. And that is the true skill set and mindset of a teacher. These following hourly wages are pulled from the Veterinary Hospital Managers Association Compensation and Benefits Report from 2009. I thought it was important for you to see how managers and people in middle management are paid. So as a hospital administrator, you may make upwards of $30 an hour, which equates to $60,000 a year. As a practice manager, you're looking at $43,000 a year, and as an office manager, around $30,000 a year. Now, I do want to point out this veterinary technician specialist is making more than a credentialed veterinary technician, and I do believe that that's important. And we will speak more about veterinary technician specialists down the road. Many of you, like I said, are already creating schedules for your veterinary technicians and assistants. Maybe you are creating standard operating procedures and doing a number of these middle and upper management tasks. Now, there is a great organization, the Veterinary Hospital Managers Association, that does support managers in all levels. And there is an opportunity for people to become certified as a veterinary practice manager. Matter of fact, a number of technicians, I'm thinking like a third of current certified managers are technicians. Another organization that could benefit you in management is the Society for Human Resource Management. We fondly call it SHRM, where you can become a professional in human resources or a senior in professional human resources. Another route for people in management is to become or receive degrees in business management. So these are all great opportunities. And as I mentioned before, I do feel middle and upper management is a great place for veterinary technicians in a natural progression to proceed their career. Here are a few more ideas. I do believe veterinary technicians make great groomers and opportunities in self-employment. Rehabilitation is definitely an up-and-coming, growing aspect within veterinary hospitals. Veterinary technicians that lean that way, have that autonomy, and have that support from their veterinarians and managers could certainly even open their own kind of ward within the veterinary hospital for rehab. Along the same lines, the use of laser therapy, and even incorporating more hospice care and palliative care within a veterinary hospital. Another opportunity for self-employment could be pet sitting, and a service within a veterinary hospital can be animal massage. So these are just some ideas. I'm sure your brain is just reeling with a number of others that you could increase patient care and services within your veterinary hospital. Further elaboration on grief counseling. We know that in the veterinary community, we see and experience the end of life 8 times more often than our human counterparts do. So within a team, if someone were to step up to the plate and say, hey, that's the aspect that I feel that I could be really good at, that would be a great place to grow your career. Further elaborating on that, let's look at that career roadmap and how this idea of increasing end-of-life care or being a specialist in that service would play out. So you are encouraged to print off that career roadmap and keep it for yourself and begin this process, or give it to your managers or veterinarian so that this could be a tool used by everybody on your team. But let's look at this idea again of end-of-life care. So how would offering this service benefit the pet? Well, this is where all pets are going towards end-of-life care at some point in time in some fashion. So to be able to offer increased patient services and patient care and tender loving care in a compassionate way that is improving the communication to the pet owner is definitely a win situation for the pet. Now, offering these services to a pet owner and a family with grief counseling, support, enhanced outreach to them is definitely a plus for that pet owner. Now, to have an expert in this arena on the veterinary team will elevate everyone's compassion and understanding, empathy and sympathy for the patient and the pet owners and their family. So that's a win-win situation. And I would bet that veterinary hospitals embracing this service would reap a positive profit off of this service as well, because it's just the best thing and we're going to be seeing more of it more often. So you can see how this is a win-win situation. Now, in order for someone to continue down this path and make this come to fruition, they might consider becoming a member of the International Association of Animal Hospice and Palliative Care. It really is an organization and it's growing leaps and bounds. The person that's pursuing this title and expertise may also consider becoming certified in pet loss and grief. There are a couple organizations that offer this certification. As you're working through this career roadmap, obviously really define those hospice care services that you will be providing, and then start to promote them on your website, within materials, just as a service that your whole team embraces. So you can see how this could increase family engagement and outreach and make that end-of-life care so much easier and less sorrowful for them. And there's this opportunity to support the patient as well with pain management and treatment. So this is just one example that you can use that career roadmap. There's so many more, but this is just a walkthrough on one example. Now, some of you might be itching to become a relief veterinary technician, and that's a great place to go, a great service to offer veterinary hospitals. I would strongly recommend you look at this as a real business and start it by speaking with a lawyer and an accountant, setting those fees and marketing that service. You can do this on your own, and if that's your choice, Karen Smith and I wrote a book called The Relief Veterinary Technician's Manual, and it's a valuable component, easily downloaded and available as an ebook on Amazon. Another option may be working with an agency for relief veterinarians, technicians, receptionists, and other services within the veterinary hospital. So becoming a relief veterinary technician is generally someone who's been in the field for a while and has that ability to walk into a veterinary hospital and hit the floor running. I've offered relief services throughout Colorado, and I found it very rewarding for a few years. Here's this idea and this growing aspect of our veterinary technology career in becoming a specialist. There's 13 options now with more on the way. In your handout, which is a download a PDF file for you, there is a list of all 13, and I will rattle these off so that you can see the choices. You may not be aware of all of them. Plus, a manager might not be aware of all of them. So here we go. Here's 13 options. The first one is emergency and critical care. Now that actually started like 15 years ago. Then this option in anesthesia and pain management. You can become a veterinary technician specialist in dentistry, in internal medicine. Within internal medicine, that academy, there's actually 5 choices. Veterinary technicians can become a specialist in behavior, in equine nursing, zoo medicine, and even surgery. There's the option of becoming a specialist in clinical practice, clinical pathology, nutrition, dermatology, and even ophthalmology. So these are growing. The number of technician specialists is growing, and the options and the choices are growing. This is very exciting. Now back to that chart previously that was listing practice managers, office managers. There was a listing for veterinary technicians as credentialed, and they were making $16 an hour, where a veterinary technician specialist was making $19 an hour. So I just point that out, that a specialist, because of their knowledge, because of the productivity, because of the services they provide, should be and can be compensated more for that and what they bring to the table. Now here is this idea of practice ownership, which in some states can be a reality. So I need for you to really research that if this is something you're interested in doing. I have a number of friends in Colorado and even throughout the United States that are part owners in practices. So this is not unheard of. And I do believe that there will be more opportunities for non-veterinarians in the future to own practices. And this is a great thing for the veterinary community. Some of you are probably grinning from ear to ear. You probably thought that this was an option, but now, yes, I'm telling you, it really can be an option for practice ownership. We just went through a lot of information in a relatively short period of time. Be aware that you have the handouts, that there are notes accompanying this presentation. Plus, there's a complete book that Dr. Karen Smith and I wrote on career choices for veterinary technicians, opportunities for animal lovers. And you can find that on the American Animal Hospital Association's press. Plus, you can just Google it on Amazon too. You can purchase it through a number of different places. But it further elaborates on all of these conversations within veterinary practice and beyond veterinary practice. So please consider that as an option. It was recently updated in 2013. And to be honest, I probably need to update it again. I'm ecstatic that you went through this entire program with me. Hopeful that you took that idea of what do you want to become without boundaries in your career, and we'll continue to elaborate on that. You can certainly reach out to me because I do offer more individualized career coaching. You may reach me at my email, RebeccaRoseCVT@gmail.com. Plus, I invite you to look at my website and follow me on Facebook. All of those are options. Other services I provide are manager mentoring, practice transformations, and speaking engagements. So if I can help you in any way, shape, or form, please, I encourage you to reach out to me. I wish you great success in your career, and know the sky is the limit. Your career is in your hands, and you can make it a wonderfully rewarding, wonderfully satisfying career. It's up to you, and I'm here to help you with that. All right. Thank you so much. Have a great day.